We now come to the backbench debate on the impact of long COVID on the UK workforce. Layla Moran to move.
Thank you very much, Madam Deputy Speaker. I beg to move that the House has considered the impact of long COVID on the UK workforce. And I would like to start by thanking the Backbench Business Committee for allowing us to hold this updated debate on long COVID today. I'd like to also thank my co-sponsors, some of which, Madam Deputy Speaker, I'm sad to say, are at home ill with COVID and would have very much have wanted to be here. Also, the moved week hasn't helped. But for those watching at home, I've been contacted by several members who weren't able to be here, and they are very sorry not to be. But I also want to put on record the thanks to the many hundreds of people who over the years have contacted the all-party group on coronavirus with their personal stories, many of them very heartwarming, but also very moving and worrying because it is a debilitating condition. And what I say to all of them is that we hear you. You have not been forgotten, and we will continue to fight for you. I also want to recognise the actions that the government has taken so far. I was pleased that after the first debate we had on this in January 2021, the government made some £18.5 million available for research into long COVID, including treatment, and then delivered even more funding in the summer, and that is incredibly welcome. In that last debate, I also welcomed the new dedicated long COVID clinics and the publishing of the guidance to medical professionals by NICE, the Scottish Intercollegiate Guidelines Network, and the Royal College of GPs. However, despite that welcome action, it has felt over the last 8 months that long COVID has totally dropped off the radar. And in particular on this issue, there's been very little debate. So I would like to thank the Minister for coming and answering today. I believe it's the first time that the Business Department has answered in this chamber on this. And I'm going to focus my remarks on the effect it's had on the workforce, because our belief is that actually this is a looming crisis that needs thinking about ahead, and it would be wrong for us just to focus on the medical side of it. There are broader implications here. And while it might have dropped off, and there are many understandable reasons, a cost of living crisis and the war in Ukraine, actually I argue that these things are now very much linked, because how are we going to have a strong economy and a productive economy if there are large swathes of our workforce that are struggling to do the jobs that they are meant to be doing? So how can we help them to recover? So in this last year that we've had more information, we have learned more about long COVID, although it's worth saying, Madam Deputy Speaker, there is still no cure. There are treatment plans that can help with symptoms. But for many, I'm afraid to say the last year has been awful. People like Andrew, who was a head teacher who I spoke about in the last debate, a year ago, he would receive multiple written warnings about his inability to do the job in the day. And so I went back to him and asked how he was. He said, "I made the difficult decision to resign from my post as a head teacher, so my limited energies can focus on coming to terms with my illness, rather than continuing to face dismissal from a career that I'd committed the last 25 years to, and one that I dearly love." I also got an email from Nell, one of my constituents who is a doctor. She said, I adore being a hospital doctor. I love my patients, and I trained for years to do this. It's been nearly 2 years of struggling with my health after COVID, and while I slowly continue to recover, I don't know if I can do this much longer. I am so very sorry. I feel I've let you down writing this. Well, to Nell I say, I don't believe she's let anyone down. But I would say I do think, to an extent, the government has let her down. I will, of course.
I thank the Honourable Member for giving way and for her excellent speech in this debate, and to also thank the Backbench Business Committee. She's raised a couple of cases that she has heard, and indeed I have been in touch a lot with a carer, Sam, in my constituency, who at the very beginning, when she had long COVID, it was a condition that people didn't understand and wasn't taken seriously, and has affected her ability to work ever since. Does she agree with me that, as well as the health side and getting more research as to how this affects people and affects them so differently, that it is very important to be having the guidance, I think she'll probably come on to this, for employers as to how to deal with this, but also how to support those who may have long COVID through that very, very difficult period. And because we don't know how long it lasts for people as well, to have a proper long-term strategy in place for those who are affected and their families.
I thank her very much for her point of order, and she hits the nail on the head, because actually people can recover, and very often do. But the way to help them do that is very badly explained to employers right now. And indeed, I'll come on to talk in some detail about that. But the other thing to say is that for many people, they were told long COVID, especially at the beginning, they were making it up. That it was something all in their head. And actually now, and I've got the research paper here, there are scans that have been done on people's chests where they saw the reason they were suffering from breathlessness is because the tissue was fundamentally damaged. This is very much a real disease and now needs a real response. But it's also not just public sector workers that have dealt with this. And I spoke to Rebecca, who gave evidence to the APPG, and she was a fitness instructor, Madam Deputy Speaker. You'd think someone, fitness instructor, very healthy, very good lungs, before anyway. She used to teach 14 high-intensity classes a week and ran her own business. And now long COVID means she's in bed 60% of the time and describes being unable to return to work, to be the mum, wife or friend I once was. And so it's heartbreaking. It's utterly heartbreaking. Because we now need to accept that if we are going to live with COVID, we also have to live with long COVID too. And yet, in our evidence sessions that we took this year in December and January, the APPG heard how the condition is severely impacting the lives and livelihoods of people still. They describe how the condition has left them unable to work, sometimes unable to move, forcing them into long periods of absence from work, dipping into their savings and doing anything to stay afloat, something of course much more difficult now with the cost of living crisis. A study released this month by Queen Mary University concluded that becoming infected with with COVID increases the risk of economic hardship, especially if the individual develops long COVID. And those individuals describe a patchwork of uneven availability when it comes to the long COVID clinics, and many are absolutely desperate for treatment. We heard from one nurse, for example, who has spent thousands of pounds going to Germany to get treatment that she isn't able to access here. So for the key sector workers, for public sector workers who gave their lives, when we were all allowed to be at home, they went in, and they are the ones, according to the ONS surveys, that have the highest prevalence of long COVID. I do believe we owe them so much more than they've had so far. And unsurprisingly, though, it's not just about the public services as well, because you've got 1.5 million people across the country experiencing self-reported long COVID symptoms. That's 2.4% of the population, and that cuts across every single sector, not just the public sector. In the hospitality sector, a sector that the Minister will know is already struggling, 2.6% of workers in that sector. If you take the 3 million estimate from UK hospitality, that equates to 78,000 workers who are unable to do their jobs as they did before. In retail, it's 2.3%, which equates to roughly just under 70,000. And for personal service, let's say beauticians, it's less than 6,000, still 2.1%. These are big numbers in sectors that are already struggling post-pandemic and already struggling with workers' visas following Brexit. They don't need this. I would, of course.
I didn't weigh in, congratulate her on, and colleagues on this important debate. And does she agree that it's not only the people who've had long COVID, but their family members who they have to care for? I've got a constituent, Julie Wells, and she's been her working life's been nearly 40 years. Her teenage daughter, on a second dose of COVID, has been left with totally debilitating symptoms and now needs constant care. Julie at best hopes to get back part-time to work, but she may not. A full-time person lost to the workforce because of caring for a family member.
Thank you so much for intervention, and absolutely, the caring responsibilities are so much increased, as is the prevalence in children. I was alerted, for example, to a case by the MP for, my friend the MP for St Albans, of a parent who's asking for dispensation for her child in taking examinations because she's missed so many days of school. And I'm talking to the Education Secretary separately about that point, but it does affect the entire family and not just the workforce. And the reason why it's 1.5 million have long COVID, but 989,000 people say that those long COVID symptoms adversely affect their day-to-day activities, and 281,000 people report their ability to undertake their day-to-day activities have been limited a lot. You know, this often means that they have to take part-time work instead of full-time work, and it very often means, sadly, that they're not able to recover well because they're pushed into trying to get back in. The effect on business is now getting better documented. The Chartered Institute of Personnel and Development found that a quarter of all UK employers cited long COVID as one of the main causes of long-term sickness absence among their staff. And for small businesses, that effect can be absolutely devastating. The National Federation of Self-Employed and Small Businesses has shared guidance in how to help